Hi, everyone, and welcome back. I'm Dr. Joanna Sun, and welcome back to the Design and Dementia podcast. So, for this episode, I'm bringing you to Italy and to a study that gives us something we rarely get in dementia care research. So, this is a really, really big national picture. This was published in May 2026 in the Journal of Alzheimer's Disease by Dr. Roberta Vaccaro and a team from the Italian National Institute of Health working through the Italian Dementia Observatory. So for this study, they surveyed 1,671 aged care facilities or nursing homes, as some of us may call it, and about 46% of all Italian nursing homes, and more than half of the beds in the country. So big study. And what they were really asking is, how well is Italy's long-term care system actually set up for people living with dementia? Not in one beautiful new facility, but everywhere. And here's what they found. So the first thing they found was that the demand is huge. Across the homes surveyed, more than half of all residents were people living with dementia. So when we talk about aged care, residential aged care design, nursing home design, we are largely talking about dementia, designing for people living with dementia. So yeah, and the second thing is, and this is the part I found really, really striking, there is a sharp north to south divide. So in the south, the average facility serves about 850 people living with dementia in the center. It's about 332, and in the north, about 214. So southern homes are carrying the largest population of people living with dementia per facility. But here's the twist. Southern facilities also have fewer beds, less staff training, less integration with daycare and palliative services, and less digital infrastructure. In the north, where demand per facility is smaller, they've got bigger and better resource homes. So something to think about here. The third thing is that dementia-specific environments, those tailored, and I'm singing to the choir here again, your physical spaces, your, wayfinding. These are scarce across the whole country, but also unevenly so. The authors describe the Italian system as fragmented, with a clear shortage of units for people living with dementia, and tailored environments and trained staff. So what do we take from this study? So the first thing is that the building people end up in really does depend on your postcode, even within one country. Dementia-inclusive design is not yet a baseline standard. It's still pretty patchy. For families, that means asking very specific questions when you visit a home. Is this space designed for people living with dementia? Are staff trained in dementia care? Does the home connect with, activities in a day? Is there palliative care, community services? And don't settle for a brochure tour, essentially. That's the bottom line. And for care workers, even when the building wasn't designed for dementia, small things matter, keeping rooms recognizable, protecting quiet corners, slowing the pace at meals, and shift times. So for designers and architects, this study is a strong argument that dementia-inclusive environments need to be the default, not a premium add-on, especially in regions with older buildings and stretched staffing. For policymakers, the message is the clearest and cleanest. The Italian Dementia Observatory now has a baseline. They can track year by year whether that gap is closing. Other countries, including Australia and Singapore, would benefit from the same kind of national picture. That postcode, that shapes your care. That's a takeaway for this week. And the link, as usual, is in the blog. And yes, thank you for listening, and take care of yourself and take care of each other. And I'll catch you in the next episode.